Hello and welcome to our Monday Night Live. And we are so happy that you are here and that you have joined us. And we do look forward to sharing with you and discussing, these matters on health. And therefore, we're going to have a very interesting time an interesting time in our session today, looking at high blood pressure. A number of individuals, they do have hypertension, and it seems to be a nightmare as to overcoming it. And therefore, I want you to ask your questions and understand very many times there are things that's driving it, and we're just not putting the finger on. But if you do talk and discuss, we would be able to figure it out together. Now, welcome. I see we have Brother George all the way from Ghana. We welcome you. And many others in different areas around the world. And we are happy that you are here. So let's go straight into our topic of discussion. Do we have any new joiners today? Hello, Sister Barbara Welch from Barbados. Okay.
Dr. Nash, good night.
Hello. Do we have any new joiners? If not, we are happy that you're here. You're in St. Lucia. And Sister May is from America. Wonderful. Thank you for coming on. And hey, so let's have a word of prayer as we get started. Heavenly Father, we give you thanks for our bodies that you have blessed us with. And we pray that God, that sometimes, situations arise and we get older and things happen, but what can we do to stay in good health? And therefore we come seeking answers. And even in this topic, that we would find solutions to help improve our well-being. This is our prayer. In Jesus' name, amen. Welcome, welcome. I'm talking to you from Pure Wellness Lifestyle Center. We're out in Trinidad and Tobago, and it's 2 countries. So I'm in Trinidad here, and we have a lovely team that's working. Right now, we have a session going on with our health retreat programs. And next month is going to be another one. So if at some point in time you feel that you need support and help with your particular health situation, even if it is to be in better health, you're okay, but you wanted to, even I tell sometimes there's some folks you can come as sort of on your vacation time and get a recharge or a reboot and have all these things done for you with the massage, the sauna, the different therapies, salt clothes, and so forth, and feel brand new again. And most times celebrating a birthday with us. We've had quite a number of those. So whatever your need might be, do reach out and we'd be so happy to support you in this. Now, our health topic is, hello, Sister Princess Ramin. Our health topic is hypertension, one nation under pressure. Hypertension, one nation under pressure. And so what are we looking at? Many times individuals say that high blood pressure is a silent killer. So we will discuss that and why it is not. And we'd also discover certain things. Now, when you take your blood pressure, hypertension is also known or high blood pressure is also known as hypertension. So there many times individuals are saying, what is it? You may ask them about high blood pressure. They know what that is, but they don't know what hypertension. It's one and the same. Okay, hyper meaning above and tension, pressure. So it's one and the same. And it happens when the force of your blood is pushing against the walls of your blood vessels, and that is too high. And so the high blood pressure can lead to other serious complications, such as heart attack or a stroke. And we don't want that to happen. Individuals may have brain bleeds, aneurysms, so we gotta be careful when we have high blood pressure. Do not just lean back and say, I am hypertensive and I have medication so I can eat and drink and do whatever I want. No way. Your medication is not food. You did not get high blood pressure because you were craving and you had a need for amlodipine or any of those of those blood pressure medications. So we didn't get sick because we were lacking them. Something went wrong in the body. And if we were to fix the cause, then there would be no need for medication. I'm not saying that if you're on medication right now that you jump off that. No way. Because what are you doing? What's the state of your body? That is for your healthcare provider to see the efforts that you're going to be putting in terms of your diet and your lifestyle, that we will discuss what that changes to make. And as you put in the work, you're going to be rewarded with free from medication. Okay, your healthcare provider will do that for you, not us. So I did say it will take work, it will take effort on your part. Now high blood pressure is personal in the sense that you have your blood pressure elevated. It's all about you. It's not about your neighbor. It's not about another family member. It's not about your colleague who may be giving you stress and causing your blood pressure to elevate it, but it's your blood pressure that's going to be elevated, not theirs. So it's personal. That's why you have to take personal responsibility for what you put into your body and what you do to yourself in order to be able to address this. So as we go through, let's see what we can learn here. Hypertension is a chronic medical condition where the blood pressure in the arteries is elevated, chronic, so it's not just a one-off. If you're diagnosed as a hypertensive individual, it should be that you have consistent readings of elevated blood pressure. And so the heart has to work harder. Poor heart has to work harder than normal in order to get that blood through to your blood vessels, to send it through your arteries. Now, blood pressure is summarized by two measurements. You have the systolic and the diastolic, the upper number or the lower number. So the systolic or systole, it's the force of blood in the arteries as the heart muscle is contracting. So as your heart muscle squeezes and blood moves up in through the aorta to be squished out into your arteries, what force is that going at? And very important, is there a resistance in the artery that is slowing down the flow of the blood to get through? If the pathway is clear, if your arteries are clear, then your blood will be able to move freely without any resistance. However, if the pathway is narrowed than normal, if there are obstacles in that pathway, your blood pressure will have to force itself. The heart has to give more energy to send that blood out into your arteries, coronary arteries. And you would see a lot of times a blood pressure stems from right there, and that can account for elevated systolic pressures. And if it is that the arteries are blocked, and I'll show you what that looks like. What that looks like, then that's a problem right there. And it's the number one problem for high blood pressure issues. On the other hand, you have the lower number, the diastolic, and it's where the measurement where the heart muscle is relaxed between the beats. When the muscle relaxes, it's getting an infill of blood, and then when it contracts, it's going to send that blood out. So how much of that blood is coming in? How much is that going to be able to squish out and to remove out of the heart to make more room for new blood? And so all of that mechanism right there is taking place. Now, the systolic blood pressure is like that top number. When it is consistently over 120, it's like 125. It's like 129. It's like in the 130s. It's in the 160s. 170s, 180s, systolic. No, that is not comfortable position. And not a comfortable number. When the diastolic number reading is over 80, it's 89, it's in the 90s, it's 105. 165 over 105. That is a high blood pressure reading. So let's have a look. Normal blood pressure, what does it say here? Anyone? Who, if you respond in the chat, and you can unmute your phone, your microphone, what does it say normal blood pressure is? What?
Less than 120 and less than 80.
Very good. And that less than is important. You know, don't be comfortable, it's a little above any of those. So it needs to be less than. Therefore, I've had individuals who would say, my blood pressure was 117 over 75. Well, that's good. It's not low, no. So if they're thinking 120 over 80, it's less than. You feel well, you feel okay, that's good. And so it's normal for you. All right, it's normal for you. Individuals, there might be some folks who are not as physically active. They will have hypotension where the blood pressure is very low, and therefore they need to exercise, they need to eat on time, drinking more water in order to raise their blood volumes to an acceptable standard. You don't want to have low and too low blood pressures because your body needs to have a certain level of blood flowing in through it. And so your heart needs to pump that out for you to feel normal, to feel comfortable. But if it's too low, you find that you could be dizzy, your hands can feel cold, you may not have enough blood. So we talked about anemia some time ago, and low blood counts could account for lower blood pressures. And that's not a safe place to be because your organs everywhere needs a supply of blood. So when we have elevated, okay, so someone is asking, what about 110 over 80? That's good. That's fine. All right, so the 80 is on the button. So that's just work. Let's get in line with doing all the healthy things, and you would be fine. And that's one of the things, you know, that the body can regulate itself. If your blood pressure is high and you apply helpful principles to your body, it will help to regulate that blood pressure. If it's too low, similarly, helpful principles can help to get it back within a normal range. Now, if it's elevated, it would be 120 to 129. You'll be getting that reading. There's an elevation, 120 to 129 and less than 80. So the systolic number is elevated here even though the diastolic number is less than 80. A high blood pressure diagnosis comes in here, 130 to 139 for the systolic, or 80 to 89 for the diastolic. High blood pressure stage 1. Then you have high blood pressure stage 2. It's 140 and above. So your 140 mark is, see, it's red. You're in a red zone. Look at these traffic lights colors here. You're in a red zone. And take a picture of this, and save it on your phone, that you can always refer to it. So if it's in the red, stage 2, 140 or higher, or 90 or higher, it's need for concern. Well, you're in a hypertensive crisis if you're higher than 180 over higher than 120. And you need to go to the hospital, to the emergency room, to go see a doctor immediately to get some intervention. So the normal range is less than 120 over 80. And once you start going up 160 and above, you can be at risk for strokes and kidney failure. There are 2 types of hypertension. We have primary hypertension, which accounts for about 90% of individuals mainly have primary hypertension. Here there's a link with the genetics. It's in their family history. And then you find that the diet is poor. Not having a balanced diet of fruits, of vegetables, of grains, of seeds, and nuts that would provide antioxidants, nutrition, phytonutrients, and so forth. Diet isn't that. Then you're not exercising, or even obesity would put you at risk for getting hypertension. So question to yourself, am I at risk for high blood pressure? Did I have a parent who had high blood pressure? Do I have other siblings who have high blood pressure? Then maybe I might have high blood pressure too. If that is your case, then good to note, but also know that you do not need to have high blood pressure. Genetics is like loading the gun, and your diet and lifestyle is what will be required to pull that trigger. So you can have it in your family, but it need not happen to you, because you're going to live and eat in a way that's different from everyone else, and keep away that family tradition and of disease passing on to you. You can rewrite your DNA, and let it be known that you can rewrite your genetics, your genes, simply by what you exposed yourself to in your environment, in your habits, in your practices, in your food consumption, and what you're having for your food consumption. We can all rewrite our genes. And that's where you see, if you had a disease condition, you can find recovery and healing can come, because it doesn't have to stay this way all the time. Your DNA and your cells and everything is speaking sickness and inflammation and so forth. But when you start to reduce that inflammation, when you start to take away the inflammatory foods and introduce anti-inflammatory foods, keeping those bowels clear, cleaning up your body and your system, you are then rewriting your DNA for sickness and disease, and your body can heal. So we don't have to stay this way with high blood pressure. It can be turned around. Now, secondary hypertension is caused by an underlying disease related to overproduction of thyroid hormones. If you have hyperthyroidism, hypothyroid, adrenal gland fatigue, because your adrenal gland tends to regulate your heart rate and your hormones and so forth. And they do play a role in individuals being hypertensive. There is where you see stress can impact. Stress is a hormone that your adrenal glands need to produce. And so the more stressed you are, your adrenal gland is hyperactive, and that could impact your blood pressure. Kidney disease, again, kidney helps with regulating blood pressure. If the kidney is not working well, there's a problem. Or infection. You can see an elevation of blood pressure when individuals have an infection going on. Similarly, an elevation of diabetes when individuals have infection going on. And so kidney disease infection, so you want to drive that infection down. Diabetes, you have diabetes, it's the same, and high cholesterol, it's the same cause for any of these within the body. If you have high cholesterol, let me show you, your blood pressure can be elevated. If you have diabetes, your blood pressure can be elevated with the insulin spikes that can cause damage to those arterial walls. And therefore, you find that the inflammation in the arterial walls can elevate the blood pressure. So on the front of things, these are causes that can be changed, and therefore healing can come. So I just want to share with you a common pill medication that may be used. And again, another reason why we should not be so comfortable with medication as the fix for our disease conditions. All medication, they do have side effects. They would do what they say they would do. For example, HCTZ, the water pill, will lower the blood pressure, but it will also do other things in the body and undesirable things. So what can happen to you and to any one of us if we were to take this? It can cause problems with the pH in our blood. It can cause a low amount of sodium and potassium, low amount of potassium in the blood. And lots of times when individuals are hypertensive, their potassium levels are low. And so there's this imbalance here of these minerals. It can also lead to high blood sugar. What is a condition where your blood sugar is high? That's called diabetes. It can also cause your blood pressure to drop lower on you when you stand, and so you feel your head light and you have to sit down. Where you can be sun sensitive when using this medication, so your skin might begin to itch when you're out in the sun. It can also cause you to lose your appetite. You have a nauseous feeling, sort of stomach cramps and sexual problems, nearsightedness, allergic reactions, hepatitis, and acute yellowing of the skin or even of the eyes, acute inflammation in the pancreas. So all of these things comes along with that medication. Now it's going to affect your kidneys. And have you noticed that you would most times be sent to the lab for blood work every 3 months when you're on these medication? It's because of the side effects, and lots of times they simply would measure and look at the health of your kidneys as well as of your liver, and cause you to run those tests, especially if you're on statins. You've got to do liver tests every 3 months to see how it's impacting your liver. So you would have to do these examinations, and you would start seeing your organs failing. And it's a connection, a direct link with your medication that you are on. Hives, rash, gout, anemia. So folks, sometimes in our chat or WhatsApp chat, people ask me questions, and I'm not so quick to respond because there is a whole lot more that's going on with them than just a response to that question. What if individuals are on medication? Could it be that they are suffering the consequence or a side effect of a medication that they are on? And not until they are off that medication would the side effect ease up. So it's important for us to look at the big picture and the whole picture. If you find brown skin blotches or large purple blotches on the skin, decreased blood platelets, so the blood could be thinner, decrease in your white blood cell, and you go do your blood work and your white blood cell is low and you're question what's going on. It's a side effect of your medication. Could it be? Have a look at that. And inflammation in your salivary glands, irritation in the stomach or intestine, so you start having digestive problems. And it's all connected, I watch and see when individuals complete their assessment form and I look at the disease that they have, the medication they're on, and I also look at other symptoms that they are experiencing. And so many times I'm linking it with the medication. When they have a numbness and tingling sensation in your fingers, sometimes maybe your toes, where you have headaches, where you're feeling weak, and even high cholesterol. So we just saw high blood sugar, diabetes, and now this medication can cause you, it's less severe, but it's still on the list to get high cholesterol. Back in 2019, this particular drug medication had a recall, valsartan, and another name, hydrochlorothiazide. And so this particular medication, it's supposed to be an angiotensin receptor blocker. What is it going to do? Relax the blood vessels so that the blood can flow through easily. And that's good. However, again, if you do have some growth of plaque deposits that's narrowing, you could relax that blood vessel all you want. This passageway is narrow. And therefore, we need to work on the pores. So let's see this item. It was recalled because there were side effects to it, even leading to cancer with some individuals. And unfortunately, individuals had a greater issue to look at. So backache and all of those things, head pain, folks are in constant pain. All right, so, okay, so all these are like more feeling weak, fever, itching, yellow vision, throat irritation, you're constantly trying to clear that throat, or you have coughs and all of those because of the medication that you're on. And look at here, some cancer, squamous cell carcinoma going on. So one of the symptoms of blood pressure, is it a silent killer? A lot of times folks may not know that they have high blood pressure until they go to have a test. A blood pressure checkup in the local pharmacy, a blood pressure checkup at a health fair, and it's elevated. Why? Oh, I just don't feel great today, and the blood pressure is checked and it's elevated, and you start looking at it, and sure enough, you could be diagnosed hypertensive. But you may also be experiencing other symptoms. And this is where I ask individuals to practice wellness. Because when you do, you would know what wellness feels like. So if you start getting headaches, then that's an indicator that something is wrong. What are you putting in? What are you ingesting? What are you exposed to? In your environment, even, what are you inhaling that is causing you to get a headache? So let's look. Some of the symptoms, folks may have headaches, day after day, lightheadedness, dizziness, a ringing in the ear, blurry vision, nose bleeds. All of these, they may be experiencing. Some or none might happen in the head area. You may be okay, but you might have a problem in your hands and your feet, where you have a slight swelling at the fingertips, and you literally could see your fingertips swollen. And the signs of poor blood flow, where your feet are cold, your hands are cold, watery tension. So you start to put on a little swelling in, around your body, in your ankle area. There's a tingling sensation that you feel in your hands. What about varicose veins? Where there's so much pressure on those valves in your blood vessels that they don't hold out well and they don't work well. Now your heart might experience racing, palpitation, or pain. And then your kidneys, you may have a lower aching back. And you're thinking it may be from your posture or the long sitting, but your kidneys are speaking to you. It might be changes in your urine color, where you have a strong smell, frequent urination, and night sweat. So that's connected to poor kidney function. And when that is happening, you need to pay attention. Sometimes simply having a urine test can tell much about what the kidney is excreting. And even a blood test would tell you certain things if your kidney isn't functioning well. And then you would need to give attention to your kidneys. With a nice kidney cleanse can help you there. What about in your bowels? You might have constipation, because if you have poor blood circulation, then in your abdomen that has a lot of blood vessels may not be fed adequate amount of blood supply, and then you can experience constipation. I've known of individuals who suffered strokes. So a certain part of the brain isn't working well, and that can affect their kidneys. It can also affect their bowel movements, because a certain side of their bowels isn't working well to really push the food along and the waste matter along. So you can have bowel problems, bloating, gas. So lifestyle, it may be sedentary, you're not active enough. You may be stressed in your space. You may have financial worries, family issues, and illness can take place. So in our lifestyle, let's look. What can it be? Any of these that you're experiencing right now? And then if you are, just simply check the blood pressure and see if it is okay. If it is not, then it's good to know so that you can take the right action. So hypertensives are 3 times more likely to have a heart attack, 5 times more likely to develop heart failure, congestive heart failure, and 8 times more likely to suffer a stroke than people with normal blood pressure. And individuals, therefore, should not be comfortable that they have high blood pressure, because your risks are increased for further disease situations. Uncontrolled high blood pressure can raise the risk of heart attacks, heart failure, stroke, kidney disease, and even blindness. You know, the pressure too high to the eyes and can cause problems. So one of the things with glaucoma, you have an eye pressure that needs to be maintained. But if you have your blood pressure that's elevated, it can even impact your retinal artery, and your optic nerves and all of those. So you want to be able to get your blood pressure in good range. This is a little diagram here. So the retina of the eye may suffer hypertensive retinopathy, where it doesn't work well because it's driven by blood pressure issues. And it's not about getting the right glasses or the right eye drops, but it's about regulating and getting that pressure into normal range. What about in the head? Strokes, confusion, headaches, convulsions, when the blood pressure is high. Elevated blood sugar can affect your aneurysms. Arteriosclerosis with your blood vessels can arise. And in your kidneys, you can have renal failure because that renal artery is not getting adequate blood supply. And the heart, well, your heart may go into heart failure, heart attack. It is a real issue. So you see, sometimes individuals have multiple things happening to them, but it's one cause that's driving it. And to get to the root cause and address that will help to alleviate many of those conditions. So let's look at some causes. And we're going to pay close attention to these causes today. And just to let you know that this hypertension topic will continue next week, because we're not rushing you through with the information, but our goal is to make sure that you understand enough to examine your own life to be able to make the change. So many individuals may listen to this presentation. If you do have high blood pressure, really take your note and use it as a guide as to what you can do, what you can have or cannot have. And as you begin to implement, you would see God is going to bless your efforts and you can find relief in your high blood pressure. Many years ago, I met a gentleman and I had a conversation with him. In fact, he called and invited, for a consultation. And he, in learning, he had high blood pressure for 18 years. It was in his family. His mother had it. His siblings had it. And for 18 years, it bothered him. Why me? Why do I have high blood pressure? I don't want this. And he would look and seek to find out what he can do to lower his blood pressure, to get it within normal range. And he would make efforts. As he found out, he learned something, he'd make efforts. But a lot of times, it is huge on our diet if we don't get it right. Unfortunately, in the nutrition world, a lot of diet modalities are shared, and not always does it work towards improving total health, improving the body for total health. And that's one of the things that I tell folks when I share with you information on health. It is looking at the total body, not just that one thing is good for one aspect of our lives, but that it should be good for everything. So getting it right. And so this gentleman, he ate meat, he ate chicken, he ate fish. And that day when he heard just a little clip from a lecture that we were talking about what could elevate the blood pressure, and he heard about meat, he stopped immediately. That very day, he did not eat the lunch that was already prepared with the chicken. He ate something else. And in the days that followed, he kept eating and avoiding the flesh food and their byproducts. And by the time I sat with him, and shared with him God's plan about eating in a healthful way in which were created and designed to eat certain foods. God did not create chicken and fish for us to eat. They're part of his creation, yes, for us to enjoy. And whatever reasons, he might have had, God is a God of abundance. And he's so creative. He could create so many things, and you may not see the need for a chicken, but he does, and so let's just go with it, but he didn't create them for us to eat and to consume. It was not part of our original diet. And so when man ate the original diet, and even today when they eat the original diet, these diseases do not come nigh thee, as promised in Exodus 15:26. So the gentleman did not eat the chicken. And by the Tuesday we talked to him, the rest of the week he continued on this path. And eventually, by the weekend when he had his visit to his doctor, it was a scheduled, ordinary, common visit. The doctor would always see his blood pressure in the range of the 160s over 130s. And now on this day, with just a week of making efforts, he not only corrected the diet, no sugar, using the right kind of salt, not that white table salt, exercising, walking, getting sunlight, increasing potassium in his blood because he will drink coconut water, not the coconut milk now, the coconut water. And his blood pressure read 120 over 80. Now, when the doctor saw that, it was like, my goodness, what is this? He had not seen this gentleman's blood pressure that come down to that number. Always it was in the 160s over the 130s. And so the gentleman messaged me and he was so elated because of the efforts done. In a short space of time, you were able to measure the results for the better. Of course, he was therefore encouraged to continue doing what he was doing, all these healthful practices, and led a healthy life. His body improved, the blood pressure went into normal range, his heart improved, and everything, started to work better for him because you are not adding what I would say fuel to that fire. So let's get it right. So let's look at the causes, General toxemia, toxic waste, always shows up in the blood, with inflammation being on the high. So when folks consume substances like artificial ingredients, you want a juice, but you go for these powdered drinks, that they are toxic to human body. It's like, what's that? What is that? You have things like snacks and so forth. What are those things indeed? If you were to look at the ingredients on the packet, it's a lot of chemicals. So when individuals consume that, what are we consuming? What are we putting into the body? Excessive fat. So do we need fat? Yes, we do. But when we use fats in an excessive amount in terms of the volumes of intake on a day-by-day basis, in terms of the concentration of fat on a day-by-day, the type of fat matters. So if we're having trans fat, and many times we don't see the fat and we think we are okay, but our body recognizes it and has to deal with it. And so that gets out into the blood. So the blood is fatty and your liver can be too. But the excessive fat in the diet can cause toxins in the blood. And you also have irritating stimulants like the coffee and the caffeinated teas and the soft drinks, the colas, the sodas, and so forth. All of those things loaded with chemicals, and they do impact our blood, making it inflamed and making it toxic. And that can irritate our blood vessels and increase the pressure in the blood pressure in our blood vessels. So let's seek to look for these toxic items and remove them. No, I'm not going to have that. No. If you want to juice an orange juice, get an orange, a real orange, you know, and suck the orange or squeeze the orange and drink the juice, as opposed to these artificial drinks that's put together by the chemicals that could give an orange flavor. You don't want that. Okay, so this is a picture of your arteries. It should be nice and clean and clear. A diagram here. Lots of times with high blood pressure, when you look at it, the cross section, you can see there's something growing on the inside. And it's a fatty deposit that's growing. They call it plaque. Yeah, but it's the wall of your arteries and it's growing and the area is narrowing. And sometimes it's on both sides and you get a narrow space for your blood to go through. These like to happen around in the arteries for our heart, in the arteries going to our legs. And so a lot of folks have leg pain and cramps and tingling sensations in their feet, in their toes, burning sensations in their feet due to poor blood circulation. And why? Because the arteries higher up are narrowed and the blood is not coming down as efficiently as it should. And therefore you can have this happening to the eyes and poor vision. You can have it going to the arteries to our kidneys. And the kidney does not get adequate blood supply. For our men, it can have a narrowing in the arteries that can service your private genital called the penis. And right there you find that individuals complain of erectile dysfunction. It's a vascular issue. And therefore, we need to get it nice and clean and clear like this so that the blood could flow through. And when the blood is flowing through freely, the pressure is going to be at normal range. But when the heart has to pump, work harder, pushing, and your aorta meets resistance along the way, because in that blood flow meets resistance, it is going to pile up and cause an impact. You see your systolic blood pressure elevated. Okay, so what we need to do is to clean this up. How could we do it? There are nice, simple ways, and we'll learn about that soon. So excessive contraction, working hard at the heart, stiffening of the arterial walls. These may not be as pliable and supple as they should be. And because of the arteriosclerosis that's going on. Inflammation in the arteries, high cholesterol due to our food intake, including stress, can elevate your cholesterol levels and cause these plaque deposits to grow from the consumption of animal foods and their byproducts, saturated fats, the oils. And there are times when individuals would say, I'm not eating any animal food, their byproducts, and when I do cook with oil, it could be olive oil, it could be vegetable oil, it could be coconut oil, it could be everything from that plant kingdom, but it is oil. And oils do not grow on trees. Oil is a processed item, and therefore you find that you would need to remove that oil from your food preparation, from your intake, and see your blood pressure come within normal range. So these inflammation, what else can cause inflammation in the arteries? It can be all wheat products that can cause an excess of the small LDL particles. So you have HDL and LDL, And so LDL can be elevated. And for some individuals, they have a reaction to wheat. They may have leaky gut, gut dysbiosis, some digestive issues, and they may not be able to break down wheat well. And that can cause an elevation in their LDL levels, and therefore blood pressure can be impacted. You also find that wheat, rye, barley, spelt, kamut, maybe some of those can impact you as well. Sugar definitely will cause an elevation of the blood pressure. And you would see coming up, we'll also tell you that sugar, when combined with sodium and even with fat, as in lots of fat fast foods, those things are like an artery blocker. They just grow the cholesterol. They just grow the plaquey deposits in your arteries and cause an elevation of blood pressure. So a lot of times we are using even sugar in our ordinary juices or any other item you're consuming. It's a need for concern. So what are some other causes you have in our meat items? It contains sodium. All of your meat in the tissues, it has sodium. There's also hypoxanthine. That's why it's so addictive. You can't leave it out like that. You have to withdraw yourself. And cholesterol is also found in these meat items, and they can clog the arteries. Homocysteine levels in the blood is increased when individuals eat the flesh food. So they can these components within the flesh foods can cause an elevation of blood pressure. So let's look. We talked about impaired kidney function, where your kidney isn't functioning well. You have narrowed arteries, even going to the kidneys, where there may be a tumor on your adrenal gland. And so your adrenal gland is impacted. That can elevate the blood pressure. Where you have defective calcium metabolism. So just the way in which calcium comes to you and how you metabolize that may not work well. And a lot of times it's because you're vitamin D deficient, that we are not able to absorb calcium well in the body that help with the contractions of the heart muscle. Then overweight, obesity, we would look at that. And then under oxygenation of the blood due to poor ventilation. Now, if you are in enclosed areas and you do not have proper ventilation, then your air supply is going to be stale. Your air supply is going to be depleted of oxygen. Oxygen helps to move the blood along, and therefore opening your windows when the day comes. Open your doors. Even if you can sleep with your window open, even if it is 1 inch of opening, that can help you to keep your blood oxygenated and cause the nitric oxide production within the blood vessels and keep your blood vessels relaxed, calm, and everything is just moving nice and slowly. But we want to make sure we get good oxygen intake. And then inadequate breathing. If we're not breathing, deep breaths. If we're not breathing properly. If you get anxious and excited, your breaths may be shallow, and that can cause an impact. Emotional instability. Okay, just one more and then we pause. Emotional instability, where you're suffering from varied kinds of emotional issues. Post-traumatic stress disorder, PTSD. You have obsessive compulsive behaviors. You have bipolar issues. All of those things tend to take a toll on the brain, on the mind. Anxiety, depression, and so a number of different states of the mind could just keep your mind going and, repeated information over in your head, and your brain isn't getting rested. That tends to ramp up an excited situation in the body. It can also increase inflammation in your blood, and that can elevate the blood pressure. So stress goes along with that. And we've done sessions on stress, so you can look in our previous issue discussions. But stress can kill you. And, just by being stressed out, your workload, you need to take breaks in between to rejuvenate and to take care of yourself. You need to refrain from certain conversations that may stress you out. You need to choose not to be stressed. You need to give your stress over to God and literally leave it there. So depressed, negative thinking is not good. I also would say negative talking is not good, because all of that just work you up and you can have problems with your blood pressure. Could be elevated. You're always talking, and it's something negative. It tends to conjure up in your chest, in your mind, a aggressive tone and spirit and all of that. You don't want that. So let's choose to speak positive things and to listen to positive as opposed to negative. It's your way of survival. Now, lack of exercise and physical activity, if this is you, then please get outside tomorrow morning and invest, even if it's 30 minutes of your time in physical activity. It's going to reward you. Now, folks may say, I don't have the energy. Do you know that when you go walking, you get energy? It's all out there when you walk. So energy is given to you as a reward, and you do have energy to go. So make it a priority to be physically active. And nutrient-poor diets, we will look at that. And contraceptives as a side effect can be high blood pressure. Drugs. Now, this can be street drugs that, again, would make your bloodstream toxic and inflamed and cause the blood pressure to go up. It can also be street drugs where you're sniffing and smoking and even the cigarette smoking. That's going to cause polluted air within your system, deplete oxygen, and cause blood pressure issues. It can also be drug medication, as we looked at an example of one. And then another cause can be the consumption of alcohol. Alcohol can, in any form, can elevate the blood pressure. Again, it's going to be inflammation created and put out into the bloodstream, and that can impact you. Now, there are some other areas and causes that we want to delve into, but we will pause now and continue at our next appointed time. I do open the floor. If you have any questions, please put it in the chat, as well as raise your hand. Maybe you've seen something here this evening that causes you to want to recheck what you might be doing. You can ask a question. Okay. All right, so let me ask you a question. Folks, do you understand that if you have an elevation in either systolic or diastolic, that you can be hypertensive and there is a need for concern? And do you understand that there are certain conditions that may exist in our bodies that can cause your blood pressure to go up? Yeah. Right. Okay. So someone is asking, what about neck pain, severe, but pressure normal? All right. So what could be causing the neck pain? Could it be your posture? Could it be your pillow when you're laying in the bed? And I don't know, Miss Giselle, if you'd like to unmute, maybe we can ask you a couple questions. If you mind sharing and talking, could it be that you have had an injury, a neck or head injury, and in that way, you do have, you know, the repercussions of that with a neck pain. So there can be several causes. And if your blood pressure is fine, then that's good. Have a look. Maybe you need a massage, and then pay attention to your posture. A lot of times that can be impacting and causing neck pain. Right. What can cause thyroidosis? The inflammation of your thyroid gland. Let's see, you could, so whenever you see inflammation going on, it can attack anywhere in the body that you have a weak area. So improving your thyroid health can be important, and then that would need to be addressed. So improving your thyroid health, reducing inflammation in the body, simply by some of these things we've already mentioned that can cause inflammation within the bloodstream. And your system is simply looking for a weak area that it could attack. Sometimes it might be even wheat intolerance, an intolerance to wheat items, gluten intolerance, and we've seen where that could impact the thyroid gland as well. Are you getting sufficient iodine in your diet? Are you using a salt that has iodine? A lot of times individuals who are hypertensive, and we will discuss salt in our next session in detail, but a lot of times individuals, when they are hypertensive, they do not use salt, and other members in their family, therefore, do not get salt in their food intake. It's like no salt. And that's not the best, because there are other minerals in a good salt, other trace minerals that the body needs. And you could be deficient. Iodine is one of them. So we want to be able to use an all-natural sea salt, an all-natural salt that has iodine in it, lest you suffer from an iodine deficient disease condition, and thyroid issues can be one of them. Someone is asking, my blood pressure is still high, even if I followed all of these healthful principles. How can this be? Am I missing something here? Well, I met someone recently who had the same question, had the very same question. How could it be? And that I had elevated blood pressure. And when we discussed, we were able to identify the oils in the food preparation. Oil in the food preparation. And to get out of that, you do not use oil. Some folks have nuts, but the portion size of the nuts is too much for your daily intake, and that would need to be addressed. The coconut oil and the coconut milk was being used on a regular basis, and that needed to be removed. And that is enough to cause a blood pressure issues, to cause high cholesterol issues, to cause narrowing of the arteries and the growth of plaque in the blood vessels. Even though you're doing everything else, but there might be some little areas in that still matters and can make an impact. So there is where we are looking at. Okay, so see, is it safe to use garlic for high blood pressure? Yes, you can. And when you cut the garlic, bruise the garlic, let it rest for about 20 minutes before you can use it. Even if you're cooking, start off, prepare garlic, cut it, leave it, let it rest for about 20 minutes so the medicinal values could come forward and help, you know, to assist your body. In emergency situation, we would use garlic, just grate it, put it on a piece of bread, have the individual eat it, and it will come down. Then I press the mic, or Mistress Alice saying when she pressed the mic, she gets cut off. Okay, I'll see if I could on mic you. I could find you. I'm not even seeing you here. EFG. I'm not seeing the name Giselle. I'll keep looking. And someone is asking, is the blood pressure a problem when you wake up at 6 a.m.? The blood pressure is 128/77. Okay, so if it's 128, something is going on in the body. And I think I saw a question earlier, maybe. Did someone ask about what about age? Yeah. Is it true that as you age, your blood pressure is elevated? That's what we see on the common ground, and the majority of people as they age, the blood pressure is elevated. It's because they have disease impacting them, and they have situations going on in their body that is leading to this. So if it is that their body was to be made well, and all of their challenging issues were to be normalized, and no stressing, and no anxious moments, and hustling on the go, then you could be okay. You could be aged and still have a normal blood pressure. In fact, I was reading earlier today, and Dr. Harvey Kellogg, he is well renowned, and he had a blood pressure when he was 72 of 118/80, that of a young man, and he was 72 years old. And so you don't have to. I've seen individuals where they had blood pressure, but they have since made changes, and they're senior, and their blood pressure is within normal range. I don't know if Sister Ramin is hearing me, but I know she was sharing this with me some time ago. And you're free to unmute, Sister Ramin, and tell us. But individuals can get to that point where they can have their blood pressure reversed and lead normal values, even though they're aged. So waking up, if you have a 128 over 77, good. But on 128, something is happening systemically, and we just need to watch from what we have discussed here this evening and see what's impacting. Most times it's that systolic is elevated because it's getting a resistance. The blood flow to flow out of the aorta is getting a resistance. There's some pressure building up there. So most times it's going to be the plaque deposits somewhere along in your arteries that's impacting you. So changes, yes, changes do work, and it can help. And like I said, look at the oils, that's quite common. Look at the fats in the diet. Any animal product will keep your condition. Okay, so you can do many things right, but you can still be feeding your condition there. Okay, all right, good. So is the garlic capsule effective? Yes, aged garlic is also effective. That can be helpful. Or if you're in the US, you can look for on Amazon for a product called Galanase, and that is very helpful. 1 capsule of Galanase is equivalent to 4 cloves of garlic. And so it's quite easier for individuals to take that capsule, that tablet, and be able to get along with their lives. Speak to people without having the garlic breath. So Galanase, it's another nice one. My 2 arms itch me for over a month now. Wow, I'm so sorry to hear that. Your arms are itching. Have you used some vinegar to try and restore the pH in on your skin to make it more acidic? You can try that. Just dilute some vinegar in water and splash it on your skin after you shower. Sometimes the pH in our water is so high that individuals, after they shower, they have itching skin. So you may need to look at also, someone is asking any particular brand for the Garlanase. Garlanase Fresh, that's fine. It may be in a brown box by now. And yeah, so do have a look as to what might be causing your itch. Is it an allergen? We talked about that a couple weeks ago. So do have a look. I wonder if my friend is on the platform. Someone messaged me a nice message yesterday. I'm not sure if she's on the platform. She had a wonderful testimony to share. My question is, I have PCOS. Coming to you, Miss
Yes,
Hale.
yes, Dr. Nash, I'm here.
Okay, go ahead. Share your testimony with us.
Okay, good evening, everyone. So my son is 14. He has allergies, asthma, and sinusitis. So on Sunday, something got into his eye, and I was on the presentation Monday night listening to Dr. Nash speak about her testimony with the turmeric and charcoal. So I decided to use the turmeric. However, I didn't have an eye cup, so I had to wait until the following day to get the eye cup. I went to 4 pharmacies, couldn't get any. So I found one that was actually in a box with a solution. So I had to buy the entire box just to get the eye cup. So I came home the evening and I gave my son the turmeric with the water, made it settle, told him to bring his eye down, just as Dr. Nash had said, bring his eye down to the cup, blink a few times, and to let the solution get in. Now, before that, his eye was very groggy, very grainy, red and itching, and he was just miserable the whole evening. So within minutes of taking the eye drop, of putting his eye in the eye mixture, the graininess stopped, the itching stopped, the pain went away. It was still a little pink, not very red, just a little pink. And by the next morning, most of the redness had gone. So the following night, we did it again. And brethren, by the next night, the eye swelling had gone down, the pain, the grogginess, everything had gone down. And I just want to thank God for Dr. Nash for telling us how to use these simple remedies and thanking God for his simple remedies as well. Amen.
Amen. Wonderful. Thank you so much for sharing and literally having the faith enough to try it and to see the results turn around in such a short time, just after 3 eye washes. And, previously possibly would have been like a nightmare for the poor child. But God is wonderful and he has blessed your efforts tremendously. Okay, so someone is sharing that I have PCOS. My diet is veggies, the oils and the proteins, no carbs at all. I am seeing an elevation in my blood pressure ever so often. I'm also insulin resistant. What oils can I use? Because I use coconut oil. Okay, so the diet consists of veggies and protein and no carbs. So right away there, that's an imbalanced diet. So we need in our diet to see our carbohydrates, proteins, our fats, those macronutrients we need to have in our food intake. There are diets out there that would promote a no-carb diet, but it is not sustainable. And therefore, what comes in its place, let's use the fats and let's use the proteins. And those will always cause issues. And then there is the diet out there where they're loading you with fats and different types of fats. It could be as good as avocado, but the quantities and the amounts and the proteins that are promoted, they are not conducive to balanced health, good health. And individuals will always have the blood pressure issues, the high cholesterol issues, and because the diet isn't balanced. You need to have the balance. And that's why I say, you know, have the right information. So you do need the carbs. Carbohydrates is like the #1 source of fuel for our body to work on. Our body was not designed to use fats. And so with a diet where they're looking at like the keto diet and so forth to burn fat for fuel, that is not ideal. And it takes a lot of work on our systems to burn that fat for fuel as opposed to burning carbohydrates for fuel. So when carbohydrate isn't there, then the body looks for what next? You know, so it's going to impact our health. And I don't see people sustaining for a lifetime on that. They always have to come back to bringing in the carbs. Carbohydrate has its place. Even on our vegetables, you do have carbohydrates. So it's not that it's a no carbs. There are carbs existing. There are protein, carbohydrates, and fats in every food. You just have an elevated amount in certain foods. So you're do having some carbs there, but you need some more. And so we need the carbs. You need to bring back in your brown rice and have your root items and seek to have a range of those through the course of the week and have a more balanced diet. When that diet isn't good, then you see a lot of variations taking place, impacting our health. So the blood pressure showing up a bit elevated. Do you know that even in the plaque deposits, that can get so narrowed once it starts getting to 75% of narrowing of arterial plaque growth in the arteries and above, individuals can begin to have angina, which is pain in their chest wall due to that pressure on the heart trying to get the blood through, and then the arteries are narrowed. And to calm that system down by having rice and peas for 2 weeks can produce nitric oxide within that system and calm those blood vessels down and relieve the pain. So there is a place for these foods. When it comes to being insulin resistant, the oils will cause individuals to be insulin resistant. Think about that your receptors on your cells and the insulin having its work to do to put glucose into your blood, into your cells to be stored. When the fat consumption is high, it will make individuals insulin resistant. It could contribute to diabetes because the insulin comes to the receptors of the cells, but they're clogged with fat. Fat from the diet, even as good as coconut oil, and that can cause problems. So you become insulin resistant and the glucose cannot get into the cells. It remains in the bloodstream. It can elevate over time and you can find that you have a diabetes diagnosis. So we want to remove the fat. We do not have to cook with coconut oil. What is your oil? Use water. Already the body is impacted here with the blood pressure, insulin resistance, and PCOS. PCOS is a hormonal issue. And therefore, and also because you're insulin resistant, it's connected to PCOS. You see all of that happening on the same level. So the oil, no cooking with the oil. Oil doesn't grow on trees. It's a processed item. The amount of coconuts that need to be condensed to produce oil is not good. It's too much. And even with the coconut milk, it's the same. And in the coconut, you have saturated fat. It's the same. Red meat has saturated fat. In the coconut, you got saturated fat. It's just from a plant source. And that is going to impact the body in the same way. So remove the coconut oil from the diet and let us use for our fats, our nuts, and our seeds. Our tree nuts, they have an abundance of fat in them. So a closed handful of your almond nuts will be good. That's just like about 6 grains of almonds. And at the end of your breakfast, at the end of your lunch meal, you close out your meals with the nuts, a close handful of the nuts. And that would be sufficient oil intake, fat intake rather, sufficient fat intake for your day, and keep your body in good. So the oil is, when we use it, it's like an excess amount of fat that we're introducing into our system, and our bodies cannot deal with that. And what does it do? It packs here, it stores there, it inflames, it just creates chaos. And you see the body is crying out with a disease that you would know, a condition. So we need to remove the oils. We will talk a lot more about that in the oil. And I am planning to bring up our next topic, which is huge, and explain to you a lot of these things that are happening in the blood vessels. But I'm just working out on that. But you have enough here in our hypertension presentation. So, okay, someone is asking again, the 128, anytime you have an elevation in your systolic or your diastolic, then yes, it is a need for concern. So don't worry too hard, but at the same time, pay some attention with what's going on. And sometimes recognize too that because of the previous way in which we would have functioned and operated and things we would have done, our bodies may be injured. There are individuals with heart problems, and so the heart doesn't work as well as it should, and you could very well see an impact of an elevation in one of your blood pressure readings. And that's just the way it is, because there's been a damage, an injury to your heart muscle. And so you just got to live with it. But the 128 isn't that high, but it's still something is going on. What can we use to help with plaque buildup in the arteries? I guess you want to ask, what could we use to decrease the plaque buildup in the arteries? And so everything that we have here on this list and the pages before, all of those will create plaque deposits in your arteries. Anytime your blood vessels are inflamed, in your toxins and all of those things, all the stress, you're creating the production of cholesterol, you're eating cholesterol, all of those will create a buildup of plaque deposits within your arteries. How could we reverse that? We will talk about that in our coming sessions. But if you're drinking your lemon water in mornings, your warm lemon water, that's a good place to start. Is it safe to use organic coconut oil? Short answer, no. No, it's not safe. If you want to oil something, you use oil sparingly. I have a friend who would say, use it as a condiment, very sparingly, but you're not cooking with it every day, no. So my question would be, what are we using coconut oil for? And if Miss Tian would like to unmute and share with us, what is she going to use coconut oil for? Then let me know. Coconut oil could be applied to the hair. It keeps your grays away. It could be applied to the skin to keep, some moisture in. What would an ECG tell you about your heart specifically? I was admitted to the hospital last year for a pressure reading, and okay, so a pressure reading that was high, and the ECG was done. Also, once plaque is formed in the artery, can it be reversed? Yeah, definitely. So once plaque is formed in the arteries, it definitely can be reversed. It takes time, but it can be reversed. Again, let's stop adding fuel to that fire. This is like one of the easiest things to reverse. It can be. Again, what will an ECG tell us? He'll tell us all about electrical currents in our system, in our heart area, and how that plays itself out in the blood vessels, give us some measurements. It can give an indicator as to that you do have a blockage along in the arteries and the force and the pressure that would be going out there. And what pressure and the contraction of the heart, how, you know, how that is playing out. So it will tell the doctors something with those charts of the ECG. But plaque deposits, pay attention, come out to our session next week, and we will continue to show you ways in which you can reduce your blood pressure, as well as to be able to get it within normal range and to reverse the arterial plaque. It's a wonderful process and it could be done. Hi, Miss Pat.
Yes. I am so sorry I came on late. I had the time wrong. But I didn't hear all that you said, and maybe that is why I'm going to ask the question I'm asking. Because I did my blood pressure. I went to the dentist and they did the pressure, and it was 127 or 28 over 70 something, or yes,
Yeah.
in the 70s. And they said that that was all right. So it's like I'm shocked now to know that that is not a good pressure.
Okay, so you went to the
I'm
dentist.
63 years old. Pardon me?
Yeah, you went to the dentist and it was okay for them for the procedure that they wanted to do with you. Okay.
Okay, so
So
that is
yeah, so
that's
that is let me see. Okay, here. So this is our chart, and this is put out by the American Heart Association as to our chart. And if we look, a 128 is right here.
mhm,
And that 128 over less than 80, it's in the yellow band.
mhm.
Yeah. So it's in the yellow band. So it's not in the green band where it's less than 120. So with that systolic being elevated, something is going on in the body. Did you ever have high blood pressure in the past?
No, I've never, no.
Okay. And then, you can do some blood work, individuals might you can do some blood work, but I'll advise, garlic is harmless to consume, so you can use some more garlic in your food when you're eating, and that can help.
Whether it is cooked or raw, does it make a difference?
It does. So when it's raw, you get an allicin, that can really bring it down quickly. Whether it's cooked, it still helps, but just that we want mild heat, not high heat on it. So
Okay.
if in a steam, if you did it steaming, you could still preserve the properties in that garlic. So I'll say just steam it for about 5 to 10 minutes, and then you switch that off, and you can cut it up and eat it in your food. But not to steam overly long. You don't want it to have high heat. Yeah.
Okay.
So if you did like anywhere like 2 cloves for breakfast, 2 cloves for lunchtime, that can help if you wanted to be a little bit more drastic. Take 4 and measure. Get a blood pressure kit and measure your blood pressure morning when you wake up first thing in the morning, and when you before you go to bed at night. So you're not on any medication. And folks, if we were to go to a conventional doctor in allopathic medicine, their first duty is to tell us to work on diet and lifestyle to correct our high blood pressure issues. And they're supposed to give us time to do that. Go make changes to your diet, make changes to your lifestyle, and then, with the aim that it would correct itself. But if that doesn't work, then the very next pill that is given is the water pill, like, for example, what we showed you this evening. And that comes in. And unfortunately, no change again to the diet and the lifestyle. it just amplifies and grows on us. So, Miss Pat, are you walking on a daily basis?
I know I do a little exercise like on the trampoline, but I know that is not enough.
That's not enough, and that isn't it. You do need a walking. And by doing the trampoline, okay, it's helping certain things, but already if you're seeing some elevation here, I wouldn't advise the trampoline because you're going to be causing that heart to exert more pressure. And if it's forcing and pushing pressure out, it could cause some injury to those blood vessels, to those arteries over time, if you're doing that regularly, because you don't want this. It's like situation up the road isn't too great, but the force of the wind, of the pressure that's coming on from lower is just going to push things all over the place. So the folks, when issues aren't doing that well with your heart, not all those exercises your heart cannot take. And this is an indicator of something that's going on in your arteries, you know. So it would be good to go get some checkup done. Make sure your heart is functioning well with the right number of contractions. But see what's going on. Sometimes an infection can throw the heart off, you know, so that all of those things you can look at. So do the walking at least 30 minutes, every day of the week. That can help. Going to sleep before and by 10 p.m. That can help. And watch the dietary changes as we've been talking. And you can go back and look at the video presentation. I'll put the YouTube channel. It's my website, drnatalienash.com, and the YouTube, it's there. Let's see, where is that? Yeah. Oh, yeah, the YouTube channel will have all the recordings. Okay.
Dr. Nash,
Yes, hi.
can I share something?
Yes, sister.
Okay, so yes, so thank you, Dr. Nash. I'd just like to share that before I started studying with Dr. Nash and Brother Luke, I had high blood pressure issues, cholesterol issues, weight issues. But once, as I learned how to maneuver the 8 laws of health and going to bed, like she said, on time, eating the same time every day, and walking out in the fresh air, and eating the healthy foods, I, ever since then, I have not had any issues. Every time I go to the doctor, they ask me, what medication am I on? I said none, and they're all amazed, and they want to know, what am I doing? And so I share with them what I'm doing. And my nurse practitioner even told me she's jealous. She said, I envy your health. So I would admonish everyone to live by the 8 laws of health. Eat healthy foods, lots of nice fresh green leafy vegetables, and the brown rice and the brown bread and all that stuff. I cook everything for myself. I don't buy food. I don't eat out. I don't eat fast foods. I don't do any of that. I cook everything, but I live strictly by the 8 laws of health. And ever since I've been doing that, I mean, I have no issues at all when I take my physical. I don't even take an aspirin, and I'm 18 years old.
Let's put that in front of the mirror and flip it. Wonderful. Thank you, Sister Raman. She's 81. Okay, folks, she's 81 and doesn't even take an aspirin. You know, a lot of times folks are being placed on aspirin just to keep that blood thin so that it can move through the blood vessels. Why? Let's get to the root cause. Why? What's blocking it there? I can't wait to share the cholesterol presentation with you guys. I have some real nice video footage and information, you know, from some top pathologists and so forth. It's going to be quite helpful to you. And okay, so let's quickly look and see. So Miss Pat, keep following us. You know, don't get too anxious, but keep following us. And as we share, it would be, and let's pray, you know, that the Lord reveals to you what your situation is, and you'd be able to correct it. And as you heard, Ms. Raman, she walks every day for like about an hour and a half. She's, of course, you know, not working, retired, and so forth. But even if you did a 30 minutes, it's still going to help. It still matters, and that can help you tremendously. All right, so
Thank you.
okay, you're welcome. I use a teaspoon. Okay, someone is coconut oil, olive oil, good for cooking. No, we don't cook no oil. We don't cook no fish. If you're looking to cook, what are you frying? Fish and plantain. Let's bake the plantain. Simply cut, slice, and put that on a baking tray. Put parchment paper in the bottom. If you could oil the pan, yes, you could. That's all. No need to put oil on the plantain itself, and you bake it, and it's gonna work. 350 you bake. It's gonna be nice and tasty. The fish, well, let's leave the fish out. So if the question is of concern about the oil, then the question should also be of concern coming from this individual as to how could I be healthy? And the fish is not going to feed us to good health. Eventually, it is something to consider to put on the side. And as we discuss, and many times individuals may not have a disease or condition that they are looking to correct. So, you know, they may not be very much interested in making adjustments right now, but at some point, you know, you're gonna be. What about grapeseed oil? All oils, dear friends, grapeseed is excellent. But from the oil standpoint, you know, it's not, the oils aren't healthy. The oil, it's processed. It's too much fat, an excessive amount of fat coming into the system at one time. And therefore you have to work on that. I was told that I have fatty liver due to a test being done. And again, what can you do to get your liver back to normal? I would say let's work on having you use a low glycemic index food intake. So you're looking to reduce your sugars in your food, reducing fat as well in your intake. So that means going for the nuts and the seeds, yes, but in moderate amounts. And therefore helping the liver to function, dandelion, slugging off and moving out some of that fatty deposit out of there, using your milk thistle to help in optimizing liver function. If the liver isn't functioning well, then you can have everything growing on it, and inflammation around the liver can cause all of that fatty liver issues. All right, would you advise eating nuts in the evenings? No. Our nut intake is for breakfast, at the end of our breakfast meal, at the end of our lunch meal, not in the evening. So your lunch meal may be between 2 and 3, okay, but not getting up into the 5 and 6 o'clock, because nuts will take long to be digested and can cause some issues on your chest. You're going to have some acid reflux, some indigestion going on. So no nuts in the evening time. All right, I think I've covered. If your pressure is constantly low, is that a cause for concern? I do feel fatigue, or do not feel fatigue or anything, but 95% of the time when I visit the doctor, my blood pressure is low. Well, you may be a happy bunny and not having a care and cause for concern in the world, and that's good. What do we consider to be low? If you're feeling fine, lots of individuals, based on their frame, their stature, and you know, they tend to run a blood pressure that is within normal, and it's good for them. Now, make sure you get sleep, at least 7 to 8 hours of sleep at night, all right, to ensure that your blood pressure is regulated. Make sure you're drinking enough water. So you're looking to get anywhere like your 8 to 10 glasses of water on a daily basis, because if you don't have sufficient water, your blood volumes can be low. And making sure you're eating a nice total plant-based diet that's balanced. You're getting your vitamin C, you have your vitamin E intake, you'll have your beta carotene, so those things can help to make your fruits, you're eating the vegetables, you're having good bowel movement. And in that way, what may be low, apparently low to a number of people, might be your normal. And so the test is, if you are feeling fine, then okay. What about pumpkin seeds before sleeping? Yeah, what to do with that pumpkin seed? Put it in a nice napkin and keep it for the next morning, for the next meal. Don't eat it at that time. All right, that's not going to be digested. That's going to stay in your system. And folks, when we don't digest our food at night and you end up having undigested food in your system, that is food for parasites and your worms. Oh, they're gonna have a feast on you. You have undigested protein in your system, they're gonna feed on that. So let's not create that situation. And I've also seen too, where a lot of digestive issues, not just the upper, where indigestion that you feel, you can have bloating, you can have gas, you can be passing wind, you can have abdominal cramps, you can have inflammation along in your intestines, simply by having undigested proteins in your system because of the late eating. So let's reserve that food for the breakfast time. Sometimes folks give you things and you're so excited. Oh, wait for your meal time, and you're going to be blessed for it. I think we've been able to cover our questions this evening. Thank you so much for your participation. I always enjoy the Q&A session, but do pay attention to the lectures, the presentations. Our goal is just to help you to improve your health and your well-being, and just witness and see that the Lord can bless you. All right. Worms don't like black walnut. Worms don't like wormwood. Worms do not like pumpkin seeds, pineapple, they don't like those things. Worms don't like the cabbage, and worms don't like anything bitter. They tend to run away from that. So you can use your black walnut, pumpkin seeds. Hi, Dr. Morgan, welcome. And you can also, use things like turmeric, and that's going to help to clear your colon as well from any excess mucus. You gotta just get those worms off your colon, and we'll do a presentation on parasites one day. But if you did things like even the plant enzymes can help to digest some of those proteins when they start to die off, and you're taking like the black walnut and the wormwood and so forth. They tend to die. The wormwood that will help to kill the eggs, and clove. So wormwood and clove can be used medicinally and to help to get rid of those eggs for the worms. And of course, every time you're taking any of those items, make sure that you have a good bowel movement and you're able to get that removed out of your colon. In that way, you would be able to have some parasites out. And parasites isn't anything that you could get rid of and then go living your life freely forever. You do need to periodically do something. Any of those items that I've mentioned, just once a month can help. By our food intake, making sure we have enough stomach acid is another way of getting rid of them. So betaine HCl can also be helpful there. So betaine HCl, plant enzymes, even oregano oil capsules, the black walnut, the wormwood, and you take them in those proportions, and your turmeric and your clove and your wormwood can go together, and that can be good for you. All right, so thank you, everyone, and let us have a word of prayer as we close out. Heavenly Father, we give you thanks for the information that we were able to discuss this evening. High blood pressure, it's something that really seems to get a hold of us, but by your grace, we can overcome this. And as we start to examine our lives, please, we ask that the Holy Spirit reveal unto us that which we ought to identify and be able to get our blood pressure within normal range and live a life that we can feel free and healthy and enjoy the blessing of the life that you've given to us. Be with each person here. We pray that they all have a good night's sleep, because sleep is important when it comes to balancing that blood pressure and regulating it. And be with us until our next appointed time, next Monday evening, as you shall grant that time unto us. This is our prayer in Jesus' name. Amen. Thank you, everyone, and
Right.
have a blessed evening.
Amen.
Thank you, Dr. Nash. Thank you, Dr. Nash. And
You're
good night,
welcome.
everyone.
Okay, good evening. Bye.